Today I will be talking about the ankle joint. The ankle joint is composed of three bones, the tibia, fibula, and talus. The tibia and fibula are bound together by tibio-fibular ligaments and form a bracket-shaped socket covered in hyaline cartilage. But I will not be talking about the ligaments today. Karan already talked about those, and so I will be covering the tendons. The first tendon that I'd like to talk about is the anterior tibial tendon, which passes anterior to the medial malleolus. On the other hand, we have the posterior tibial tendon, which is a large tendon that passes posterior to the medial malleolus. Then we have the Achilles tendon, which stretches to connect your calf muscle to the calcaneus, which in layman's term is known as the heel. This is done through the posterior side of the ankle. The lateral malleolus is the prominence on the outer side of the ankle formed by the lower end of the fibula. The retinaculum is a band that is wrapped around tendons for the main function of stabilizing them and holding them in place. In the ankle, the retinaculum is a Y-shaped band starting at the calcaneus and extending medially as it splits to each side of the fibula and passes behind the peroneus brevis and in front of the peroneus longus. The ankle is a synovial joint and functions as a hinge type joint. This means that it can only move in two directions, up and down. The ankle can either go through dorsiflexion or plantar flexion. Dorsiflexion is the movement of the ankle upwards from anatomical position, while plantar flexion is a movement of the ankle downwards. Both of these movements take place in the sagittal plane and transverse axis. When dorsiflexion occurs, the anterior part of the talus is held in the mortise and the joint is more stable. When plantar flexion occurs, the posterior part of the talus is held in the mortise, making the joint less stable. These are the only movements allowed by the ankle joint. Eversion and inversion are produced at other joints of the foot. The mortise is the socket that is covered in hyaline cartilage that I talked about in the beginning of this PowerPoint. Next, I'll be talking about a sprain and a strain. These two terms are often mixed up, although are very different. An ankle sprain is when a part of all the ligaments in the ankle joint are torn. Keep in mind, this is ligaments only and not tendons. Strain, on the other hand, is an injury to the tendons, which can either be a tear or just a small stretch. This commonly occurs due to excessive inversion to a plantar flexed and weight-bearing foot. The lateral ligament is most likely to be damaged because the lateral ligament is weaker than the medial ligament, and the lateral ligament resists eversion. Tendons are less likely to be stretched because they are more elastic than ligaments. The anterior talofibular ligament is a lateral ligament that is most at risk of irreversible damage. Soccer. The most common injury in soccer is due to the overuse of the lower body and is Achilles tendonitis, which is the pain in the Achilles tendon which attaches the calcaneus to the ankle. Soccer is a sport which requires a lot of movement of the ankle and use of the calf muscle. Soccer players are constantly moving and staying on the balls to their feet to stay prepared. This too creates pressure on the Achilles tendon. Along with the Achilles tendon, the posterior and anterior tibial tendons are also being overused due to the tremendous amount of running and kicking on the field. Aside from injuries due to overuse, when several players are surrounding the ball, there is a lot of pressure for the players to come out with the ball, which increases the risk of an injury such as rolling an ankle by stepping on someone or simply losing footing while running at full speed.